we're going to do. We're going to get you loaded onto the helicopter and get you into a hospital.
What we do now is we bring the emergency room to the patient, and we work through the online medical control. And through the medical control that we have, the physicians, they build working relationships with us. They get where they trust us. They count on our skills and our abilities, and they trust our judgment. And we do a lot of what we do without ever having to make any contact with the physicians. And a lot of times we do most everything up to the point that we make the contact in flight after we've started the transfer. It saves a lot of time that way, and the patient can get the care more rapidly.
There are 6 Air Evac bases in the state. West Tennessee is served by helicopters located in Martin, Jackson, and Waverly.
This is our stretcher that pulls in and out for loading the patient. And the patient will lie with their head here, feet downward. We package them in this stretcher, and then we just move them inside, latch it up, and from that point secure. A conscious patient can sit with their head elevated if they need to, if they'd like to. Some of our trauma patients usually are lying flat and strapped on backboards and such. We have heart monitors, both portable and stationary, have IV pumps, portable suction, all the things that an ambulance has. We have oxygen. We have headsets that the flight crew has to wear to be able to communicate with each other in flight because of the loud noise that the aircraft produces. Over here is our drug box, and that's where we carry a lot of our IV fluids and medications that we use. This is our basic, what we call our first out bag. It has most of our life-saving equipment that we need to get to the patient in a small package. We can typically handle anything in flight. A cardiac arrest, if the patient suffers a cardiac arrest, we can handle that in flight for a limited amount of time, and we'll need to get to a closer medical facility than what we might be transferring to, so we might have to divert. But we should be able to handle any emergency in this situation just as you would in an ambulance.
In an accident scene, that's usually time is more critical there. You know, they've had impact or trauma. So he does a really quick, head to waist, and I do belly to feet. And if there's IVs that need to be started, then generally I'll start those, and he'll manage the airway. And, if the airway needs suctioning or anything like that, he usually is in charge of that. And, we've just got a real good system, and we generally fly with the same partner. So flying with the same person, you just develop a trust, and it just makes it a lot easier as far as assessing your patient and everything. I don't have to second guess what my partner's doing, and I'm just used to flying with the same person. That works out real well.
Air Evac Live Team, this is Paula.
The company has a centralized dispatch system which routes the nearest aircraft to a scene. The medical personnel also have contact with expertise on the ground.
We have medical control through our company that provides us with what we call standing orders, which are written protocols and orders that we have to follow in certain emergency situations where we can't get a physician online. But we have online medical control also through the radio system, such as if we're going to Vanderbilt or the Med in Memphis, we can contact their medical control and confer with them on certain situations.
The helicopter of choice is the Bell Jet Ranger, a modest medium-range aircraft well suited to tight landing zones.
I'm a retired Army aviator, and the Army taught me to fly. This company here has probably the majority of the pilots are ex-military pilots. Tennessee has probably the highest experience requirements of any state in the nation. Really? Yeah, you need a minimum of 3,000 hours to work in Tennessee in the emergency medical service, and therefore they have a lot of retired military aviators and former military aviators. Men and women that have had the ability to build that much flight time.
At the base, pilots have access to the latest weather and terrain information and a link to updates from the FAA. Jock says the Bell Ranger and Air Evac are poised for most anything.
We flew a gentleman a couple months ago that was a linebacker for San Diego, I believe is where he's from. He's from Hopkinsville originally. He was involved in a motorcycle accident, and we were able to carry him. I think he weighed 320 pounds. We were able to take him out of Hopkinsville and get him down to Vanderbilt. So, yeah, there probably are some people we couldn't fly, but I haven't run across one yet.
Our criteria is based on the patient's need for advanced care in a rapid situation where they need to get to a higher level of care from where they're at, if it's a hospital transfer, in a rapid amount of time. We can do a transport of a patient from facility to facility in about a third of the time that you can by ground. As far as the scene settings, patients that are critically or severely injured or critically ill, we can get to them more rapidly sometimes than an ambulance in the rural setting, and then we can transfer them to the hospital in, like I said, about a third of the time.
The most unique thing about Air Evac is that it's available to everyone for pennies on the dollar. And with the right conditions, they'll even land in your yard.
We register the coordinates, the GPS global positioning system coordinates for that person's residence, so we know exactly where they are. Should we need to respond directly to their home or residence along with their local ambulance service. And then two, and probably the most significant, is the potential financial benefit. And that is the fact that if you are a member of Air Evac and you're supporting us through this program, then we don't intend for you to receive a bill personally for any part of that flight charge. So if you have insurance available, we will bill whatever insurance you have, and then whatever they pay is what we accept, and we don't intend for anyone that's supporting us and allowing us to do what we do to receive a bill for their services.
The company's economic model is based on membership dues, $40 to $50 per household per year. There is also a $500 lifetime membership available.
It's not limited to children. It could be an elderly parent that's had to come back and live with you. So as long as they're part of your household unit, then they would be party to your membership. Folks, when they hear about our program, they say, well, let me have it, let me know what these rates run. And when you tell them, they say, well, I really can't believe that you're able to keep the rates down where they are. And as an employee and a representative of the company, I'm proud of the fact of what the company's been able to do as far as holding those rates steady. Those annual rates have actually been in place now for 16 years, and we have not had to adjust them. Now, that's not to say with what fuel and insurance is costing these days that at some point we may not have to a little bit. But the driving force, I think, behind what we've been able to do with those rates is this: if we can build that membership base wide enough, and the support in those areas that we service is spread out among those households in that area, then our company has obviously now for 16 years been able to hold those rates down to where it's really more of a support decision than it is financial for most folks.
Financial indeed. An average flight will cost $5,000 to $8,000. Insurance programs will pay somewhere between $2,000 and $3,000. The difference is spread across the dues collected from the membership base. We
operate very efficiently. We're probably one of the most efficient companies in the air ambulance industry, and that's by design, so that we can place more aircraft in more areas and provide this service to those rural areas that don't have access to definitive carrier-ready access. And I believe it has a lot to do with the management and the mindset of the company.
That's a mindset rural communities can appreciate. The fatalities of farming, hunting, and recreation accidents will likely go down with access to time-saving medical response and transport.
It's different every day, and you get to help people. You get to, in rural West Tennessee, I was out there on the ambulance for several years when I didn't have the help, I didn't have the backup, I didn't have the helicopters available. And we would pick patients up knowing that we had to waste a lot of time before they would get to the advanced care they needed at the bigger medical facilities, such as the major metropolitan type medical facilities like Memphis and Nashville and Jackson.
It's being able to take care of people when they need someone right then, right there, for specific needs. And it just means a lot that, I've had, education and training and stuff to be able to take care of people and, to recognize if something's not going right and then being able to intervene. And, if it's children, I always think of my children, how would I want someone to take care of them? And, if it's, an older person, I think, well, how would I like my parents to be taken care of? And, everyone here at this base is real personal about that, and we take care of the patients that we come into contact with the same way that we would our family.
I've worked for airlines, I've worked in corporate aviation, I've worked in general aviation, and this kind of operation is, it's basically, to me, it's the ultimate airline. It's saving people's lives 24 hours a day, 7 days a week.
It looks like For the first 12 months of operation, we will have transported nearly 400 patients out of this base here in Martin, Tennessee. So that's an average of better than one a day. And here we are in August of '04, and through mid-August, the midpoint of the month, we've logged 31 flights already, and that's just a pace that I don't know that any of us really expected.